Across the country, there's a noticeable increase in women acquiring and storing emergency contraception, like Plan B and abortion pills. This trend, while concerning to some, reflects a complex reality faced by women today. It's essential to understand the motivations driving this behavior and address the implications for women's health and autonomy. We live in a time when reproductive rights are increasingly under scrutiny. This climate creates fear and uncertainty for many women, leading them to take control of their reproductive health in ways they see fit. While stockpiling medication might seem extreme to some, it's crucial to understand the context driving these decisions. There are numerous reasons why women are choosing to stockpile these medications. This trend is not just a random occurrence, but a response to a variety of pressing issues that women face today. One significant factor is the changing political landscape surrounding reproductive rights. The political climate has become increasingly volatile, with laws and regulations shifting rapidly. The recent overturning of Roe v. Wade has created a sense of urgency for many, fearing restricted access to safe abortion services. This landmark decision has left many women feeling vulnerable and uncertain about their reproductive futures. Social factors also play a role. The societal pressures and stigmas surrounding reproductive health can be overwhelming. Stigma around sexual health and reproductive choices can prevent women from seeking timely medical advice. This stigma can be particularly intense in conservative communities where discussing such topics is often taboo. This is particularly true for younger women, minorities, and those in rural areas. These groups often face additional barriers to accessing healthcare, including limited resources and lack of anonymity. Having these medications on hand provides a sense of control and security in such situations. For many, it's a way to take charge of their own health and well-being amidst uncertainty. Personal experiences further contribute to this trend. Stories shared among friends and within communities highlight the importance of being prepared. Some women have experienced sexual assault or contraceptive failure, leading them to be extra cautious. These traumatic experiences underscore the need for immediate access to emergency contraception. Others may be in unstable relationships or face pressure from partners that makes accessing reproductive health care challenging. In such cases, having medications readily available can be a crucial lifeline. The combination of political, social, and personal factors creates a compelling case for stockpiling medications. It's a proactive measure that many women feel is necessary to safeguard their health and autonomy. Ultimately, stockpiling is about empowerment and preparedness. It's about ensuring that women have the resources they need when they need them to make informed decisions about their reproductive health. The safety of using Plan B and abortion pills without direct medical supervision is a topic of much debate. Medical professionals generally agree that both medications are safe for most women when used as directed. Plan B, also known as the morning after pill, is designed to prevent pregnancy after unprotected sex or contraceptive failure. It is most effective when taken within 72 hours. Abortion pills, on the other hand, are used to terminate an early pregnancy and typically involve a combination of medications. These pills are usually prescribed by a healthcare provider and require careful adherence to instructions. However, individual health factors can influence the suitability and potential risks of these medications. For instance, certain pre-existing medical conditions might make using these medications unsafe. Conditions such as severe liver disease, certain types of cancer, or blood clotting disorders can increase the risks associated with these medications. Consulting a healthcare provider is crucial to determine individual risk factors and receive appropriate guidance on usage. A thorough medical history and understanding of any underlying health issues are essential for safe use. Moreover, while these medications are generally considered safe, misusing them or exceeding the recommended dosage can lead to complications. Overuse or incorrect use can result in side effects such as nausea, vomiting, heavy bleeding, or even more severe health issues. It's vital for women to have access to accurate information and medical advice to ensure they use these medications safely and effectively. Educational resources, counseling, and open communication with healthcare providers can empower women to make informed decisions about their reproductive health. In conclusion, while Plan B and abortion pills offer important options for women's reproductive health, their safe and effective use hinges on proper medical guidance and individual health considerations. Always consult with a healthcare professional to ensure the best outcomes. The legal landscape surrounding Plan B and abortion pills is constantly evolving and varies depending on location. It's paramount for women to be aware of the laws in their state regarding accessing and using these medications. Plan B, being emergency contraception, is generally available over the counter without age restrictions in most states. However, access to abortion pills is more complex and often faces legal challenges and restrictions depending on the state. Several organizations provide legal guidance and support for women navigating this complex legal landscape. Resources like Planned Parenthood and the ACLU offer up-to-date information on state laws and can help women understand their rights and options. There are many misconceptions surrounding Plan B and abortion pills, often fueled by misinformation and stigma. These myths can create unnecessary fear and confusion, preventing people from making informed decisions about their reproductive health. One common myth is that Plan B is an abortifacient, which is untrue. Plan B, also known as the morning after pill, is designed to prevent pregnancy, not terminate it. Plan B works by delaying ovulation, preventing pregnancy before it occurs. It essentially stops the release of an egg from the ovary, ensuring that fertilization does not take place. It does not terminate an existing pregnancy. If you are already pregnant, Plan B will not have any effect on the pregnancy. Another misconception is that using these medications frequently is harmful. While it's true that they are not intended for regular contraception, occasional use is considered safe by medical professionals. However, relying solely on these methods for long-term birth control is not advisable. They are designed for emergency situations and should not replace regular contraceptive methods. Medical professionals recommend using more consistent and reliable forms of contraception for ongoing protection against pregnancy. Options such as birth control pills, IUDs, and implants are more effective for long-term use and provide better peace of mind. It's also important to remember that experiencing side effects from these medications is normal and usually mild. Common side effects include nausea, cramping, and changes in the menstrual cycle. These side effects are generally short-lived and should not cause significant concern. However, if you experience severe or persistent side effects, seeking medical attention is crucial. Always consult with a healthcare professional if you have any doubts or questions about using Plan B or any other emergency contraceptive. They can provide personalized advice and ensure you are using the medication safely and effectively. Section 6. Plan B and abortion pills. What they are, how they work. Plan B, also known as the morning after pill, is a type of emergency contraception. It contains a higher dose of the hormones found in regular birth control pills. Taking Plan B within 72 hours of unprotected sex can significantly reduce the risk of pregnancy. Abortion pills, on the other hand, are used to terminate an existing pregnancy. This method, known as medication abortion, typically involves a combination of two medications, mifepristone and misoprostol. It is a safe and effective option for ending a pregnancy in the first trimester. Understanding the difference between these two types of medication is crucial for making informed decisions about reproductive health. Section 7. The emotional toll. The decision to stockpile Plan B or abortion pills is often accompanied by complex emotions. Fear, anxiety, and uncertainty about the future of reproductive rights can weigh heavily on women. It's essential to acknowledge and address the emotional impact of these decisions. The current political climate can make women feel like their bodies and reproductive choices are under attack. This can be incredibly stressful and isolating. Seeking support from trusted friends, family, or mental health professionals can be invaluable during these challenging times. Remember, you are not alone in feeling this way. Many women are experiencing similar anxieties. Openly discussing these issues can help reduce stigma and foster a sense of solidarity.